Behind the sterile walls of hospitals lurks a bacterium that is causing outbreaks and challenging doctors worldwide. Meet Elizabethkingia. Number 1. What is Elizabethkingia? Elizabethkingia is a genus of gram-negative, rod-shaped, non-motile bacteria commonly found in soil, water, and hospital environments. It is an opportunistic pathogen that can cause serious infections, including meningitis, bacteremia, and pneumonia, particularly in newborns, the elderly, and immunocompromised individuals. Number 2. Why it was named as Elizabethkingia? Elizabethkingia was named in honor of Dr. Elizabeth O. King, an American microbiologist who contributed to the study of this bacteria. Number 3. Where is Elizabethkingia found? Elizabethkingia is commonly found in natural environments such as soil, fresh water, and hospital water systems. It has been detected in treated drinking water, medical equipment, and healthcare settings, where it can persist on surfaces and in biofilms. Number 4. How does Elizabethkingia spread? Elizabethkingia spreads primarily through contaminated water, medical equipment, and healthcare settings. It can persist in hospital water systems, sinks, and biofilms, leading to outbreaks in medical facilities. Transmission occurs through direct contact with contaminated surfaces, medical devices, such as ventilators or catheters, or healthcare workers' hands. While person-to-person transmission is rare, infection is more common in immunocompromised patients. Number 5. What types of infections does Elizabethkingia cause? Elizabethkingia primarily affects immunocompromised individuals, causing severe infections such as bacteremia, meningitis, pneumonia, endocarditis, and skin infections. It can lead to sepsis, respiratory distress, and neurological complications, especially in hospitalized patients. Due to its high antibiotic resistance, Elizabethkingia infections are difficult to treat and often have high mortality rates. Number 6. Who is at risk of Elizabethkingia infections? Individuals at higher risk of Elizabethkingia infections include immunocompromised patients, newborns, the elderly, and those with chronic conditions like diabetes or cancer. Hospitalized patients, especially those with ventilators, catheters, or other medical devices, are more vulnerable. Outbreaks often occur in healthcare settings, affecting individuals with weakened immune systems. Number 7. What are the symptoms of Elizabethkingia infection? The symptoms of Elizabethkingia infection vary based on the affected body system. Bacteremia may cause fever, chills, and sepsis, while meningitis can lead to headache, neck stiffness, and confusion. Pneumonia symptoms include cough, shortness of breath, and respiratory distress. Infections like endocarditis and skin infections may present with chest pain, swelling, or wound complications. Severe cases can result in multi-organ failure and a high risk of mortality. Number 8. How is Elizabethkingia diagnosed? Elizabethkingia is diagnosed through laboratory tests such as blood cultures, cerebrospinal fluid analysis for meningitis, and respiratory samples for pneumonia. Advanced techniques like PCR and MALDI-TOF mass spectrometry help in rapid identification. Antibiotic susceptibility testing is crucial due to its multi-drug resistance, guiding effective treatment. Number 9. Is Elizabethkingia resistant to antibiotics? Yes, Elizabethkingia is known for multi-drug resistance. It is resistant to many commonly used antibiotics, including beta-lactams and aminoglycosides. Number 10. What antibiotics are used to treat Elizabethkingia infections? Elizabethkingia infections are typically treated with antibiotics like fluoroquinolones, trimethoprim sulfamethoxazole, minocycline, and rifampin. Due to its multi-drug resistance, combination therapy is often required to achieve effective treatment. Antibiotic susceptibility testing is essential to identify the most effective drugs for each case. Number 11. How can Elizabethkingia infections be prevented? Elizabethkingia infections can be prevented through strict infection control measures in hospitals, which includes proper hand hygiene, sterilization of medical equipment, and regular monitoring of hospital water systems should be done properly. Early identification and isolation of infected patients, along with maintaining clean environments and avoiding the use of contaminated medical devices, are crucial in preventing outbreaks. Number 12. Have there been outbreaks of Elizabethkingia? Yes, outbreaks of Elizabethkingia have occurred, particularly in hospitals. A notable outbreak took place in Wisconsin, USA, in 2015-2016, where multiple cases and deaths were linked to contaminated hospital water sources. Such outbreaks are often associated with high mortality rates, especially in immunocompromised patients, due to the bacteria's antibiotic resistance. Number 13. Is Elizabethkingia dangerous? Yes, Elizabethkingia is dangerous, especially for immunocompromised individuals. It can cause life-threatening infections like bacteremia, meningitis, and pneumonia. Its ability to resist many antibiotics makes infections difficult to treat, leading to high mortality rates, particularly in hospitalized patients. Proper diagnosis and prompt treatment are crucial to managing the risk. Number 14. Does Elizabethkingia affect healthy individuals? Elizabethkingia generally does not affect healthy individuals. Healthy people are typically resistant to infection, but in rare cases, it could cause mild illness in otherwise healthy individuals. Elizabethkingia primarily targets those with weakened immune systems, such as newborns, the elderly, and patients with chronic conditions or those undergoing medical treatments like chemotherapy. Thanks for watching. If you learned something new today, give us a thumbs up, share it with others, and subscribe to keep learning with us.